Okay, we go to the 5 transporting points. Jing spring points. Lung 10, the fresh border. Lung 10 location at the midpoint of the palmar border of the first metacarpal bone. How to find? With the thumb relaxed. Palpate the belly of the tenor eminence from the palmar to lateral, the radial side. Then palpate the first metacarpal bone. Lung 10 is located at the midpoint of its palmar border. LU4 is located on the dorsal aspect of the hand, close to the second metacarpal bone. Needling vertically 0.5 to 1 tune. Caution, painful point. For the action indication, regulates the lung qi, cools blood heat, expels pathogenic factor from the throat, descends rebellious qi, harmonizes stomach and heart. Special features: yin spring point, fire point, important distal point for sore throat caused by wind heat. This is the main point to clear lung heat, and it can be used for both full or empty heat. Lung 5 also clears lung heat, but more when heat is combined with phlegm obstructing the chest. Lung 10, on contrary, clears lung heat, especially in acute situations, for example, at the qi level of the 4-level pattern identification. Lung 10 also clears heat from the throat and is therefore used in sore throat from heat or from wind heat. It is not used for sore throat from yin deficiency, except when combined with other points such as kidney 6. As it clears heat, it also clears heat from the heart and treats mental emotional symptoms deriving from heart heat such as fear, mental restlessness, anger, manic behavior, fright. Expel wind heat and benefits the throat, acute sore throat, and tonsillitis. It also extinguishes interior wind and promotes resuscitation. Lung 10 is the yin spring and fire point of the lung channel. According to the classic of difficulties, yin spring points are indicated for heat in the body, and lung 10 is effective to clear heat from both the lung channel and the lung sung. It is a general characteristic of more distal points of the channels that they treat disorder of the upper end of the channel. The internal pathway of the lung channel rises to the throat, and lung 10 is a major point for a wide range of throat disorder characterized by heat and dryness, whether due to deficiency or excess, and is indicated for pain, swelling, congestion, and dryness of the throat, and loss of voice. Excess heat in the lung sung may be subdivided into predominance of heat or predominance of phlegm. Lung 10 is indicated in the former, while points such as lung 1 and lung 5 are preferable for the latter. If heat lodged in the lung obstructing the descent of lung qi, it will lead to coughing. The fluids of the lung are vaporized by heat, there will be sweating, while if lung heat has scorched and consumed the fluids, there will be coughing with absence of sweating. The extent of the sweating, therefore, indicates the severity of the heat. By virtue of its action in clearing heat, lung 10 is equally effective in clearing lung heat deriving from deficiency of yin. Lung 10 is indicated for bleeding disorders affecting all three jiao. Lung heat may injure the vessels of the lung, causing coughing of blood, transmit to the origin of the lung channel in the stomach, causing vomiting of blood, or transmit to the heart, and thence the small intestine and bladder, giving rise to blood in the urine, which may be accompanied by genital damp, itching, or impotence. Lung 10 is able to harmonize the relationship of the lung and heart on the one hand, and the lung and stomach on the other. According to the warp and woof of warm fiber disease, the lung and heart are mutually connected. Thus, when there is lung heat, it most easily enters the heart. If lung heat agitates in the upper jaw, therefore, it may transmit to the heart, causing agitation and mental disturbance such as anger and mania. Alternatively, if the gathering qi is deficient, when the qi of both the lung and heart will be deficient and unable to circulate the blood through the heart with consequent stasis of the heart blood. Lung 10 is indicated for diminished qi, shortness of breath, and heart painful obstruction. The lung channel originates in the middle jaw in the region of the stomach. The lung 10 is able to clear heat which transmit to the stomach channel, giving rise to toothache, lacrimation or breast abscess, counter dual rebellion of lung and stomach qi, manifesting as cough with hiccup, and treat various disorders of the stomach fu, including abdominal pain with inability to eat or drink, vomiting, childhood nutritional impairment, and esophageal constriction due to middle jaw deficiency. Finally, lung 10 is an important local point in the treatment of pain and heat of the thumb joint. Thank you for your attention.
Let's talk about bladder 40, middle of the CROOK, a 5 command point. Bladder 40 is located in the center of the popliteal crease between the tendons of the biceps, femoris, and semitendinosus muscles. How to find bladder 40? This point is best located with the patient's knee slightly flexed. Locate the center of the popliteal crease. A pulse may be palpable, and there, locate bladder 40. Located on the same level are bladder 39, which is one soon laterally, kidney 10, located more medially between the tendons of the semimembranosus and semitendinosus muscles, and liver 8, located more medially anterior to the tendons of the semimembranosus and semitendinosus muscles. Needling of bladder 40 is done vertically, 0.5 to 1.5 soon. Caution, because we have the popliteal nerve, artery, and vein located deep to this point. Use moxa with caution, contraindicated according to some authors. To clear heat and eliminate stasis, we bleed the superficial veins, possibly followed by brief cupping. Caution, only used for excess conditions and in constitutionally robust patients. Bladder 40 is also indicated as a distal point for the lower back. Needle with the patient standing. For safety and balance, use a treatment couch or chair as a support for the hands, and ask them to move their lower back gently while manipulating the needle, with only short needle retention. When needling this point with the patient in a prone position, place a supporting roll or pillow under the ankles to relax the popliteal crease. Actions or indications of bladder 40: clears summer heat, stops vomiting and diarrhea, cools blood, benefits lower back and knees, opens the channel and luo vessels, alleviates pain. Special features: Husi point, earth point, lower Husi point of the bladder, Madanyang heavenly star point, Kawu command point of the lumbar region. Important distal point for the lower back, a point with a wide range of indications. Bladder 40 is a major acupuncture point. Also called equilibrium middle, it describes the effect of this point on the mind and spirit. When fear is scattering and disorientating the person, showing as nervousness, anxiety, and inability to settle, the steadier, deeper energy of the Husi point, together with centering and harmonizing effect of earth, helps the person contain and compose themselves and gather their thoughts and senses. Earth within the water brings stability. As a yang Husi point on the lower limb, it has an influence on its associated fu, the bladder. Because Husi points are situated where the command points end, they are seen as being a transitional state where external pathogens might enter more deeply into the body. WEIZHONG points present an opportunity, if pathogens have entered this far, to dislodge and expel them. They are indicated for diseases of the skin from pathogenic invasion. Because they are the most proximal of the transporting points, they affect the center of the body more than the far reaches of their meridian, which is affected by more distal points like the Jingwell points. The energy of WEIZHONG points is slower, deeper, and more stable than that of the more distal points. WEIZHONG points can be used to supplement or tonify qi as well. Bladder 40 clears heat and resolves damp from the bladder. It is applicable in urinary problems like painful urination, cloudy urine, blood in urine. Bladder 40 also clears heat from the blood and moves obstructions from the meridian, so used for blood stasis in the legs. It clears summer heat and so is used when someone has suffered an acute attack of heat leading to delirium, rash, or fever. As a WEIZHONG point affecting middle of the body and a point which moves qi and thus eases pain in the bladder meridian, it is a frequently used point for low back ache, chronic or acute, although more frequently used in acute cases and when the ache is on one or both sides of the spine rather than on the spine. As a local point, bladder 40 is a useful point for many knee disorders. It relaxes the sinews, benefits joints, and removes obstructions from the bladder meridian. Bladder 40 is the WEIZHONG point of the bladder channel and has long been considered one of the most important of the acupuncture points. According to Madanyang, the great physician of the Qin dynasty, bladder 40 is one of the 11 heavenly star points indicated for lumbar pain with inability to straighten up, severe lumbar pain that radiates up the back with pain and stiffness of the sinews and bones, wind painful obstruction that frequently recurs, and difficulty in stretching and bending the knee. The Ming Dynasty author Cao Wu, in the glorious anthology of acupuncture and Mock Sebastian, included it among his 4 command points, with a special action in the treatment of lumbar pain. Sun Simiao, in the 1,000 Ducat Formulas, says of bladder 40, pain of the lumbar region and spine that almost reaches the head. In any case of heaviness and pain of the lumbar region and leg, bleed this point. Bladder 40 is equally effective for acute or chronic lumbar pain, whatever the etiology, and for sciatic pain radiating down the bladder channel, and is an important point for atrophy disorder and painful obstruction of the lower limb. In the case of acute lumbar sprain, bladder 40 may either be needled or bled by the following method. The region of bladder 40 is examined on the affected side if the sprain is unilateral, and on both sides if bilateral. If dark and engorged blood vessels are seen at around the bladder 40 point, the patient is asked to stand, resting their hands on the couch. The blood vessels are slapped to further engorge them and promote the flow of blood, then wiped with alcohol and quickly pricked to induce bleeding. Thank you for your attention.
Now let's talk about spleen 21, the great wrapping, the last among the Luo-Connecting points. Spleen 21 is located on the mid-axillary line in the 6th intercostal space. We have to note that according to some texts, this point is located on the 7th intercostal space. So how do we find spleen 21? We locate the 6th intercostal space by counting pyrosternally from the clavicle or from the manubriosternal synchondrosis, and we follow the course of the interspace in a lateral direction and locate spleen 21 on the axillary midline. We also have to note that the intercostal space laterally curves upward. Spleen 21 is often sensitive to pressure. Another way is to locate spleen 21 on the mid-axillary line, midway between the axilla and the end of the 11th rib. Needling spleen 21 is 0.5 to 0.8 tune obliquely or transversely, or also subcutaneously, and which is we needle this parallel to the intercostal space or with or against the channel pathway. We have to exercise caution as needling this point may cause pneumothorax. For its actions and indications, spleen 21 regulates chi and blood, governs and wraps all the Luo-connecting vessels of the body. It also unbinds the chest. For special features, spleen 21 is the great Luo-connecting point of the spleen. It is also the exit point. Spleen 21 controls all the blood connecting channels throughout the body. It is used in generalized pains due to stasis of blood in the connecting channels, the main symptom being muscular pain moving throughout the body. Spleen 21 is the point of departure of the great connecting channels of the great connecting channel of the spleen, which from this point disperses in the chest and ribs. This point's name is translated as general control, as the word bao, which normally would mean envelope, here has the meaning of controlling, taking upon oneself. The name therefore refers to the general controlling action of this point on all the blood connecting channels. So to summarize, spleen 21 invigorates blood in all blood connecting channels where it could manifest with pain in the whole body. It also benefits the sinews and regulates chi in the chest. The name of the point, spleen 21, is made up of two characters, da meaning great and bao meaning to wrap or to envelope. According to the spiritual pivot, the great loop, the spleen, is known as da bao. It emerges at 3 chun below the axilla, spreading the chest and lateral costal region. When it is excess, there is pain of the whole body. When it is deficient, the 100 joints are flaccid. This channel embraces the blood of all the Luo-connecting channels. A possible explanation of this passage from the spiritual pivot is that one of the functions of the Luo-connecting channels in general is to assist in the distribution of qi, and more especially blood, to all the tissues of the body via the network of the minute Luo-connecting channels. Since spleen controls blood, its great Luo-connecting channel dominates this function of blood distribution throughout the body. When blood stagnates, there is pain of the whole body. When blood is deficient and unable to nourish the tissues, the 100 joints are flaccid. Spleen 21 is also mentioned in the Ode to Elucidate Mysteries, which says that it dominates the upper region, where spleen 25 dominates the middle region and spleen 8 dominates the lower region. Despite these two classical references, spleen 21 appears in no traditional combinations in any of the major classical texts. The spleen great connecting channel brings together from the exterior to the interior all the minute blood connecting channels throughout the body. It is like a great protective envelope that permits exchanges to be carried out within it. For this reason, it is sometimes called the junction point of junction points. Spleen 21 moves blood in the connecting channels. The great loop, the spleen, works from outside to within, while the spleen works from the center to the extremities or periphery by its nourishment of the yin officials and its relationship with the stomach. Together, spleen great connecting channel and the spleen official unify and regulate, bring movement and sustaining life. Diffusion of the great connecting channel of the spleen over the chest as well as the pathway of the spleen means this point is good for moving stagnation of blood, relieving fullness, lifting oppressions and depression in the heart area, bringing relief and harmony, rhythm and order where there was dissonance. Spleen 21 allows the spleen to circulate freely and pass through constriction and preoccupation with elegant fluidity. Spleen 21 is used for generalized pain from blood stagnation and the connecting channels, the main symptom being muscular pain moving throughout the body. It moves stagnant chi and blood, particularly in the chest, as spleen 21 controls the great spleen connecting channel, which radiates through the chest. It is often combined with spleen 4, the opening point of the chongmai, which flows through the 3 jaws and affects chi and blood in the chest. All this connection with blood and chi and the areas affected enable the person to feel held and enveloped. Bao means envelope. It is through the spleen, stomach representing the center of our being, which provides for the exchanges of heavenly and earthly influences and transfers them, ends its superficial pathway with this link with the Great Lu junction point, which encourages even more exchanges raised to the level of the heart. This point is considered the junction point of all junction points. It brings all around harmony, uniting all the meridians. Can be combined with spleen 4, which is the opening of the point of the chongmai, thus connecting with all the 3 jaws. The use of this point can help a patient feel enveloped by Mother Earth's attributes of care, support, and nourishment, especially if these are lacking in their life. This point connects to Heart 1. Thank you for your attention.
We continue with the back transporting points, bladder 42, door of the corporeal soul. Location, 3 Chun lateral to the posterior midline on the level of the lower border of the spinous process of the 3rd thoracic vertebra, T3. How to find? After locating the spinous process of C7, count down 3 spinous processes to the lower border of the spinous process of T3. Located on this level and 3 Chun lateral to the midline is bladder 42. Or with the patient seated and the shoulders in a relaxed position, the spinous process of T3 is generally on the level of the medial end of the scapular spine, an easily palpable structure. Locate bladder 42 on the level of the lower border of the spinous process of T3, 3 Chun lateral to the midline. With the patient's shoulder relaxed, 3 Chun corresponds on this level to the distance from the midline to the medial border of the scapula. Located on the same level are LU12 on the midline, a point of EXB2, 0.5 Chun lateral to the midline, and bladder 13, 1.5 Chun lateral to the midline. Needling obliquely 0.3 to 0.5 Chun, caution, pneumothorax. For the action indication, bladder 42 tonifies and nourishes the lung. Alleviates wheezing, coughing, calms the corporeal soul. Opens the channel and alleviates pain, clears heat from the lungs. Bladder 42 has 2 main actions on a physical and psychological level. On a physical level, it can be used to regulate and send lung qi downwards in the treatment of cough and asthma. It is also frequently used for painful obstruction syndrome of the upper back and shoulders and is frequently tender on pressure. Needling this point can greatly relieve pain and stiffness of the upper back or scapula area. On a psychological level, it is related to the corporeal soul, the PU, which is the mental spiritual aspect residing in the lungs. It strengthens and roots the corporeal soul in the lungs. It frees breathing when the corporeal soul is constricted by worry, sadness, or grief. It calms the mind and settles the corporeal soul to make the person turn inwards and be comfortable with oneself. It is used for emotional problems related to the lungs, particularly sadness, grief, and worry. It has a very soothing effect on the spirit, and it nourishes chi when this is dispersed by a prolonged period of sadness and grief. The explanation of the acupuncture points reports the interesting indication 3 corpses flowing for this point. The association with the corpses and death should be interpreted in the way that this point is indicated for suicidal thought. As we have seen above, when discussing the indication of bladder 13, the corporeal soul is associated with ghost and spirit and with a centripetal movement, eventually ending in death. For this reason, these 2 points are indicated for suicidal thoughts. In fact, all 3 lung-related points, bladder 13, LU12, bladder 42, all on the same level, have indications to do with death. These are the bladder 13, desire to commit suicide, LU12, desire to kill people, bladder 42, 3 corpses flowing. So we have here the illustration of the location of LU12, bladder 13, and bladder 42. Bladder 42 is located on the outer portion of the bladder channel on the back at the level of the bladder 13, the back-shoe point of the lungs. The name of this point, door of the corporeal soul, suggests that it is effective in treating disorder of the corporeal soul and emotional disorders related to lung disharmony. In fact, with the exception of 3 corpse possession disorder, the classical indication of this point predominantly reflect its use in nourishing and tonifying the lungs. 3 corpse possession disorder is a Taoist concept that refers to some form of possession and is divided into upper corpse, which attacks the eyes, middle corpse, which attacks the 5 sang, and the lower corpse, which attack human life itself. The predominant clinical picture expressed by the classical indications for this point is one of severe exhaustion of the lung. It is indicated for lung atrophy, lung consumption, deficiency taxation, taxation cap with heat in the body, etc. In its ability to strengthen the lung at the deepest level, it is similar to bladder 43, although less renowned. According to the essential question, the 5 outer bladder points level with the 5 sang back-shoe points, that is the bladder 42, bladder 44, bladder 47, bladder 49, bladder 52, drain heat from the 5 sang, an action shared by the back-shoe points of the 5 sang. Thank you for your attention.
Now let's talk about the Luo-Connecting channel of the large intestine. The connecting channel starts at LI6, from where a branch connects with the lung channel. From LI6, a branch runs along the main channel on the arm to the shoulder, jaw, and teeth. From the jaw, another branch enters the ear. So let us review the pathway, this time in more detail. The large intestine Luo-Connecting channel system begins at the Luo-Connecting point, LI6, where it branches off from the primary channel and forms a 3-dimensional reticular network, dividing into numerous branches and sub-branches within the surrounding tissue. Horizontal divisions course to the interiorly-exteriorly paired lung primary channel. According to some schools, they travel as a transverse lung Luo-Connecting vessel to the Yuan source point, lung 9. A longitudinally orientated division follows the large intestine primary channel to LI15, continues via the supraclavicular fossa to stomach 12, and along the neck to the mandibular angle where it spreads. One branch runs to the teeth, another branch reaches the ear, where it communicates with all channels reaching the ear. So what is the clinical importance of knowing the Luo-Connecting channel of the large intestine? So for excess conditions, this would be very helpful for disorders of the teeth and gums, disorders of the ears. For deficiency conditions, sensitive teeth and gums, such as sensitivity to cold, sensation of tightness in the chest and diaphragm. So let us now review for the nth time the large intestine connecting channel. Begins at LI6, then joins with its exteriorly associated lung channel 3-tune above the wrist. Ascends the arm through LI15 to the jaw and cheek, where it divides, one branch connecting with the teeth, the other connecting the ear to join the tongmai, where the channels of the large intestine, stomach, small intestine, gallbladder, and sanjiao gather and collect at the ear. So here is a very simplified illustration of the large intestine Luo-Connecting channel. Thank you for your attention.
Let's now talk about location methods and tune measurements. Still on the head, we'll discuss center of face and the nasal region. So we'll start with the cheekbones. Both the maxilla and the zygoma form the cheekbones below the eyes. Important anatomical landmarks are the infraorbital foramen, the lower border of the zygoma, and the zygomatic arch of the temporal bone. Here is an illustration showing where the infraorbital foramen is, the zygomatic bone, the frontal squama, and the maxilla or the upper jaw. Okay. The infraorbital foramen. With the patient looking straight ahead, the infraorbital foramen with stomach 2 is located on the maxilla, directly below the pupil. The foramen lies 1 finger width below the infraorbital ridge. By palpating inferiorly from there, it can be felt below the maximal curvature of the ridge in a small depression that is often sensitive to pressure. Next, we have the zygoma. The bony structures below the lateral orbit are formed by the zygoma. Point SI18 is located directly below the outer canthus of the eye at the lower border of the zygoma, at the junction of the zygoma and the maxilla on the anterior border of the masseter muscle, which is in the lower face and chin. Next, we have the zygomatic arch. On the lateral aspect of the face, the temporal process of the zygoma articulates with the zygomatic process of the temporal bone to form the zygomatic arch. This is approximately horizontal bony structure which can be palpated laterally to the ear. Points gallbladder 3 and triple burner 22 are both located on the upper border of the zygomatic arch, was points stomach 7 and triple burner 21 are situated on the lower border. Here again is an illustration showing where the zygomatic arch, the mandibular angle, the occipital bone, the temporal bone, and the points GB3, triple burner 22, 23, and stomach 7. Okay. Next, we have the temporomandibular joint or the TMJ. The temporal mandibular joint is located inferior to the zygomatic arch and anterior to the tragus of the ear. Its movement can easily be palpated by gently opening and closing the mouth. Stomach 7 is located in a depression anterior to the joint and directly inferior to the zygomatic arch. This depression is situated in the mandibular incisure, which is formed by the coronoid and condylar process of the mandible. By opening the mouth and the palpating finger resting on stomach 7 is lifted out of the depression by the condyloid process sliding anteriorly. Okay. Here again is another illustrations showing the mandibular incisure, the mandibular head, the articular disc, the external acoustic meatus, the condyloid process, and the ramus of the mandible and the coronoid process. Here again, the mandibular head, where the articular disc, this is another angle. External acoustic meatus, the articular capsule, and the ramus of the mandible. Okay. Next, we have here the nasolabial groove. The nasolabial groove begins lateral to the nose and superior to the ala nasi at the junction of the cartilage and the bone. From there, it runs to the corners of the mouth. Point EX, H, and 8, an extra point, is located at its upper end at the junction of the upper jaw and the nasal cavities. Point LI20 is located slightly below this BITONG, or the extra point mentioned earlier, between the lateral border of the side of the nose and the nasolabial groove. Thank you for your attention.
We continue with the discussion on the window of heaven points, stomach 9, man's welcome. Location 1.5 June lateral to the anterior midline on the level of the laryngeal prominence and at the anterior border of the sternocleidomastoid muscle. How to find? Stomach 9 from the laryngeal prominence, palpate posteriorly to the anterior border of the sternocleidomastoid muscle. Stomach 9 is located at the anterior border of the muscle, which becomes more clearly visible and palpable if the patient's head is turned in the opposite direction. Located on the same level are SI16 on the posterior border of the sternocleidomastoid muscle and LI18 between the two heads of the sternocleidomastoid muscle. Needling, if necessary, move the head to its normal position before needling. Caution, carotid artery, carotid sinus, jugular veins. Okay. The carotid artery is located directly at the anterior border of the sternocleidomastoid muscle. The needle should be inserted anterior to where you can feel the pulsating of the carotid artery. Vertically, 0.5 to 1 tune between the artery and the thyroid cartilage. For reason of safety, the artery should be held in a lateral position with one finger of the palpating hand above and one finger below the insertion site. Irritation of the carotid sinus can lead to a lowering of the blood pressure and fainting. For the action indications, stomach 9 regulates the chi, opens the channel, harmonizes excess or deficiency in the thorax. Special features, stomach 9 is the window of heaven point, C of chi point, meeting point with the GB channel. Stomach 9 is used to remove obstruction from the head and subdue rebellious chi. This function is due to its nature of window of heaven point, as these points regulate the ascending and descending of chi to and from the head. Stomach 9 is therefore often used in excess pattern, characterized by excess chi on the top part of the body. It also dissipates nodules with such symptoms as adenitis, nodules on the vocal cords, and swelling of the thyroid. According to chapter 33 of the spiritual axis, this point is a point of C of Qi together with Ren 17, Do 15, Do 14. It can therefore be used to tonify Qi, although it is more often used to regulate Qi and eliminate imbalances in the distribution of Qi, resulting in excess above and deficiency below. Stomach 9 is used to remove obstruction from the head and to subdue rebellious Qi. It is often used in excess pattern characterized by excess Qi on top part of the body. It dissipates nodules with such symptoms as adenitis, nodules on vocal cords, and swelling of the thyroid. Stomach 9 also a point of the C of Qi used to regulate Qi and eliminate imbalances in the distribution of Qi, resulting in excess above and deficiency below. Stomach 9 is also known as its alternative name, Heaven's 5 Meetings. It is one of 5 points known as Window of Heaven, literally 5 regions of the Window of Heaven, points in the spiritual pivot, which states headache due to rebellion of yang, fullness of the chest with difficulty in breathing. Choose stomach 9. Located in the pivotal neck region, stomach 9 dramatically illustrates the characteristic ability of this group of points to reestablish harmony in the flow of Qi between the body and the head. The rebellion of Qi, which arises when the Qi in the lower region is disordered and chaotic, may manifest in various ways. In the head, it gives rise to headache, dizziness, and redness of the face. In the neck region, it stagnates, giving rise to scrofula and goiter. In the middle and upper jaw, it endures the normal descent of stomach and lung Qi and gives rise to vomiting, sudden thermal disorder, wheezing, asthma, and fullness of the chest. According to Su Shi Kong, instrumentally of the above passage with the spiritual pivot, the condition known as inversion Qi, disordered, chaotic, and rebellious Qi, underlies the clinical manifestation of all the points of the Window of Heaven. One of the manifestations of inversion Qi is sudden acute pain, and this echoes the important modern use of stomach 9 for acute lumbar sprain, as well as sprain and severe pain in any region of the body. The ability of stomach 9 to reorder rebellion and upsurge of Qi also explains its strong action in reducing hypertension. According to the chapter Discourse on the Seas of the Spiritual Pivot, stomach 9 along with Ren 17, Do 15, Do 14 is a point of the C of Qi. This passage gives the following indications for insufficiency and excess of the C of Qi. When the C of Qi is in excess, there is fullness in the chest, urgent breathing, and a red complexion. When the C of Qi is insufficient, there is scanty energy, insufficient for speech. Dual and overlapping properties of stomach 9 as a point of the C of Qi and a point of Window of Heaven underline its importance in harmonizing and redistributing disordered Qi in the body. As long ago as the Yellow Emperor Inner Classic, observation and palpation of the pulse at Ren 9 was considered an important diagnostic method. The essential question in discussing obstructed urination describes a pattern of heat in the body like charcoal. The neck and the chest are obstructed as if separated. A restless and abundant pulse at stomach 9 and dyspnea with counterflow Qi. Elsewhere in the essential question, great diagnostic significance is ascribed to relative strengths of the pulses at the wrist and the stomach 9. While Songjing refers to the 3 methods of pulse diagnosis, stomach 9 in the upper, the wrist pulse in the middle, and stomach 42 in the lower. Because of the complication inherited in these methods, They were abandoned relatively early in the history of Chinese medicine in favor of focusing in the wrist pulse. Thank you for your attention.
Let us now talk about the wind damp heat and wind dry heat patterns for common cold and influenza. Wind damp heat, clinical manifestations, aversion to cold, shivering, fever, a feeling of heaviness of the head and body, nausea, vomiting, swollen glands, headache, feeling worse in the afternoon, a feeling of oppression of the chest and epigastrium, a sticky taste, tongue, sticky yellow coating, pulse would be slippery and floating. This corresponds to the beginning stages of invasion of wind heat combined with exterior dampness, because wind heat affects the upper burner and dampness more than the middle burner. Besides the usual symptoms, there is also nausea, sticky taste, and feeling of oppression of the epigastrium. Obstruction of the muscles by dampness causes the feeling of heaviness. Acute mononucleosis often presents with symptoms of wind damp heat. Treatment principle: release exterior, expel wind heat, resolve dampness. Points: LI4, LI11, SPLEEN9, REN9, REN13 type, Ripple burner 5, DO14, and LU11 using reducing method. LI4 and LI11 release the exterior, expel wind heat, and resolve damp heat. SPLEEN9 resolves damp heat. REN9 and REN13 resolve dampness, harmonize the center, and subdue rebellious stomach chi. TB5 expels wind heat. DO14 clears heat and is selected if heat is pronounced, as in high fever. LU11 bleeding method expels wind heat and treats inflamed tonsils. Now let's go to wind dry heat. Clinical manifestations include aversion to cold, fever, slight sweating, dryness of nose, mouth, and throat, dry cough. Tongue slightly red in the front and dry. Pulse is floating. This pattern occurs in places with a very dry climate, such as Arizona or New Mexico. It may also occur when someone who has been invaded by wind is subsequently in a very dry, centrally heated house or workplace. Treatment principle: release exterior, expel wind, restore the sending of lung chi, benefit fluids. Points: LU7, LI4, LU11, REN12, spleen 6, kidney 6. Reducing method on LU7, LI4, and LU11, and reinforcing on REN12, spleen 6, and kidney 6. LU7, LI4, and LU11 release exterior and expel wind heat. LU11 is bled if there is sore throat. REN12, spleen 6, and kidney 6 promote fluids. Kidney 6, in particular, soothes the throat. Thank you for your attention.